Hi everyone, I'm Tash,
And I'm Damo.
and together we are so excited to bring you this week's episode of
The Bari Chronicles.
This week, we are going to talk about our personal experience with plastic surgery.
I like plastic surgery.
Plastic surgery. So,
The glad wrap.
yes. Now, we all know that after bariatrics, we can be a little bit extra.
A bit loose.
A bit loose, a bit extra in the skin department. And that was definitely the case for me. I really noticed it probably at around about 40 kilos loss. Everything sort of started just rapidly having a meeting with gravity.
South for the winter?
Yeah, very, very south. All the things were going south. I didn't know that it was possible for knees to sag, but they can. That was fun. Arms, my mons, like how does that actually happen? But it did. It really did. And I remember
like a sleeve of the wizard.
Definitely. I remember looking down one day when I got out of the shower and just wanting to cry because, oh my God, like, what do you even do? What do you even do with it? And in very like serious terms, I guess, for me, I really couldn't imagine that I was ever going to be able to get it fixed, to be perfectly honest. I had no idea about the costs involved. I had no idea about any of it. And it all felt like just another whole world. I mean, bariatric surgery was a world all of its own with a language all of its own and 57 acronyms for different things and what do you ask and who do you ask. And then there was the next stage of that, which was the plastic surgery phase. And I found that really daunting.
Yeah, I think I was sort of the same. And I think what we don't realise is when we're living in a bigger body, the fat accumulates everywhere. And so as we start losing that, if our skin doesn't have that elasticity anymore, it doesn't shrink back. And this is something that I really want to say. There's lots of creams and ointments and potions and all that sort of stuff. If you have severely loose, sagging skin, they won't work.
100%. 100%.
If someone tells you that they will, well, ask them to give you a free sample if they're that sure of it.
Yep.
Because
100%.
So my legs, they were sagging. I lost a lot of muscle as well,
yeah, me too.
which didn't help. But my stomach around my tummy was terrible, and I was getting these rashes, and the skin would tear, and it didn't matter.
Anyone would think we're related.
Yes.
Same deal for me, Damo.
Yeah. And it didn't matter how much I showered and kept myself clean. And I think that was so hard for me because when you're living in a bigger body anyway, people automatically assume that you're fat, lazy, and unhygienic. And that couldn't have been further from the truth for me and for all of us, you know. And it didn't matter how much I put powders on and all that sort of stuff. I would, by lunchtime, especially living in southeast Queensland, it would be just this big congealed mess
of sweat
and powder and yuck,
so
and it stunk. It was painful. My belly button was always getting infections. And I was desperate to get rid of the apron.
Yeah, 100%. I used to say to myself, "You smell like you could use a shower, Stinky." Like that was 100% me, to me.
Yep.
You know, at lunchtime, at dinner time, at breakfast time, I was always very, very conscious of all of my skin folds and everything like that. I don't think that it's possible to understand that unless you've actually lived with it.
I mean, walking through the shop and you're there going, "What is that?" Oh,
it's me. And you know it's because there's a raw bleeding rash somewhere. Yep. And the pain of living with that, going to the doctor constantly, you know, topicals, but also antibiotics, it becomes, for me anyway, that part of it became incredibly depressing.
Yep.
And my mental health definitely began to suffer, which wasn't something I was really expecting. When I was young and I lost a lot of weight, admittedly not as much as I lost with gastric bypass, but when I had lost a lot of weight, my skin reasonably went back. I still did have an apron, but it wasn't to the extent that it was after my weight loss
surgery. Wasn't protecting your knees.
No, that's right. So, oh gosh.
I had like a barbecue apron.
Yeah.
Like serious. It was like, you know, I could have done welding.
Yeah.
Oh, look, and Damo, being protected.
I can, as in, mate, I can completely relate. I really can. And for those listening who are currently living with that, please know that the back of me right now, today, is exactly like the front used to be. So I am still living with that. I know Damo.
Tash just uses bulldog clips to pull all the skin.
Oi!
Joking.
Don't reveal the set. Actually, I have done it a time or two where I've had to clip my skin. Yes. So there you go. Like, we actually do still live with excess skin, both of us.
Yeah. I've got terrible around my legs, and I've actually sort of almost been wondering if there's some lipedema there or something because of just the way it
looks.
Looks and feels. And you know, so I lost over 100 kilos, and I still felt absolutely miserable because I wasn't expecting all this loose skin. That was a really big thing, and it was still worth having the weight loss surgery because I needed it for my health. But it's something that we have to consider when we're doing it, is there may be some skin issues.
And how will I feel about those skin issues? We can't really know until we're in it. And, you know, obviously it will depend on your age, it will depend on your genetics, it will depend on how much you've lost. It depends on so many things. But there is no exercise for the amount of excess skin that I had. There is no amount of muscle that I could have built unless I built up the same amount to fill it in. So for me, even though I was exercising, gymming, doing all of those things, I still had an extreme amount of sag. Now, what was the path that you went down, Damo? Because we did go down completely different routes.
Yeah, very, very different. So when I had my weight loss surgery, I'd been living with chronic pain for about 7 years at that point. And I was on Centrelink, so it was hard. We paid for it out of pocket. We paid for our private health, and you know, there was a lot of sacrifices for our family to be able to do that.
Yeah.
And the thought of plastics was just totally out of my reach at that time.
Now there are public wait lists, aren't there?
Yes, and actually I was accepted onto a public wait list for my chest, but due to an accident and other things, I put on 2 BMI and was kicked off the wait list. But that is definitely something that is worth looking at. If you really, what you need to be accepted onto a public wait list, and you might need a GP that's really going to advocate for you, but obviously you need to have lost a lot of weight. You need to have the excess skin. You need to have proof and rashes and so it's got to be documented.
Take photos
and
go see your doctor.
It also, if it's affecting your mental health, it helps to have even supporting letters from like a psychologist or we need to be able to make our case if we want to be on the public list. And you know what, totally worth it.
Yeah, completely.
My surgeon, he was a general surgeon, but he offered to do my tummy tuck.
Yeah.
And I jumped at that. I had seen some horror stories and I was a little bit nervous, but he'd not only operated on me, he'd operated on my grandmother when she had to have skin cancers removed. He'd operated on a number of our family. So I trusted him when he said that he could do it. And I had a fantastic result. The cut that he had to make was 1 meter from my hip to my hip. Oh my God. And it was massive. It was well over 5 kilos of skin and tissue and that he took. It took me ages to recover.
Yeah.
I think even now I look back and think it was probably one of the hardest recoveries that I've had, just because of how huge the surgery is. You realise how good the microsurgeries and all that is when you have something that you have to be cut open for.
Yeah,
100%.
And
they take all this skid away. I was on a one of those pain push buttons for nearly a week. Like he didn't let me out of bed for 5 days because it was such a big procedure.
Big old cut. Yeah.
And I didn't realise just how big an operation it was going to be.
Yeah.
But I'm forever grateful that I went through with it. And I think the important thing is that, sometimes we can't afford to see a plastic surgeon because they are expensive. But what we need to do is some research and find out what we can afford and do the best that we can.
Yeah. With the information that we have. So you used a general surgeon.
Yes.
And he was your weight loss surgeon.
Yes.
And it was a really good outcome for you. I know that other people in your immediate family and friend circle have also used the same surgeon for tummies and things, and they've all had really excellent outcomes. So that's wonderful. And then there is the public system.
Yes.
Now, in Australia, there is also the Access program if you have private health, and you can just look that one up yourselves. But I know that they also can do some plastic surgery at a lower cost if you meet all of the criteria. For me, I went down a different path. I went down the route of going and seeing a plastic surgeon. And I haven't really ever discussed the exact costs of that, and I don't intend to do that today. But what I will say, though, is that it was not gifted to me by the surgeon or anything like that, but someone in my life did come to us and talk to us about that and wanted to do something for me. So without that, at that time, I would not have been able to have the procedures that I had. So that's just me being very, very honest about that situation. That's why I don't discuss costs and things. And I will be forever grateful for that. It absolutely, completely changed my life, being able to get rid of the apron. It was, and I think that that Damo will be putting some photos up, but you'll be able to see just how my skin was, and living with the rashes, living with the constant tearing of my skin, because my skin was extremely prone to tearing, constant infections. I'd been on antibiotics for a couple of years anyway, just because of how often my belly button was breaking down. It was horrible. It was absolutely awful. And getting the skin removed and my muscles tightened was life-changing. Absolutely life-changing. It changed my bladder. It changed the way that I felt in my body. It changed my balance. It changed so many things. And I just would never, ever have thought that it could be that transformative. But it definitely was. So my first surgery was an extended tummy tuck, and it went from hip to hip. At that time, I also had my boobies done. I had a lift and a reduction, and I had something like 64 staples in each nipple.
Wow.
It was scary. You wake up from surgery, you look down, and you go, ah!
Christmas bauble.
My nipples are stapled on. I hope you're going to be okay, girls. So I had that done, and I had a Mons lift because that area of me was incredibly stretched. I'd had some traumatic issues go on earlier in my life, but then also I'd had some other things happen, like some surgical things happen. And when I had our third child, he was born very prematurely. And then 5 weeks after his birth, I was rear-ended in a car accident, and my cesarean scar burst open. So I had hernia, I had all sorts of things going on down there. So that area just needed quite a bit of work. And so I had a Mons lift as well. And I had some complications on the day of the surgery. I spent some time in ICU, but after I started to recover, I realised just how life-changing it was going to be. However, my skin, being my skin, and the amount of weight that I lost, I ended up very, very crinkly again within about 4 days of the surgery.
Wow.
So that was really, really confronting. I thought, oh my God, I am destined to be all crinkles forever. And I did have a revision, went to a fleur-de-lis, which is where you have the incision up your tummy and also across, and they tightened everything up, and that looked really good for a bit, and then I got crinkly again. So for me, it was kind of a bit of a realization that my skin was probably just a bit too far gone, a little bit too damaged, and I was going to have to manage my expectations.
And that's, I think, for me, that is such a key
I agree.
to the entire process. We often will go into weight loss surgery, and I know I did, wanting to look a certain way after I finished.
Yeah.
And when that didn't happen, I had all this emotional baggage that I had to deal with. And I think a lot of it, well, for me it did, it came back to my own personal weight bias.
Yeah,
That
100%.
because I was overweight, because I had all these things going on in my head, that I wasn't acceptable a certain way, and that I had to be a different way for me to be acceptable. Yeah. And that's bullshit.
It is
straight up.
absolute bullshit.
So this is where I think the mental health specialists, psychologists come into play, because if we think that just having a procedure done is going to change the way we feel about ourselves, a lot of times we're going to be really disappointed.
Yeah, I couldn't agree more. That is so incredibly true. I vividly remember looking down at myself, lying on my bed, looking down at myself, crying, because I was still wrinkly. I was still sore. I was looking down at myself, still seeing everything that I used to see. And it took time. It took work. It took working with a psychologist. It took learning to care about myself, love myself, see value in myself just because I'm me, for that part of things to slowly change. And oftentimes I think we can even feel a little bit of shame about wanting to look a certain way. Like, we kind of feel, well, I know I did. I felt, I should just be grateful that I got to have the surgery.
I was going to say I felt ungrateful because I still had these issues going on in my head and I hadn't told anyone, and everyone around me is going, "Oh, you look great. You're doing so good," and I'm there going, "I'm miserable."
And there's that voice in your head that just doesn't want to. Well, for me anyway, it didn't want to allow me to be happy. I used to just see every imperfection, see every flaw, and that was part of a very, very toxic thought process that I had going on, and the way that I used to evaluate everything that I did. And I'm still, if I'm honest, I'm still very hard on myself a lot of the time, but I have certainly learned to be much, much kinder to my skin, much, much kinder to my body, because holy fuck, it's done an amazing job.
That's right.
It's done an incredible job to be able to carry me through life, to be where my body is today. And for me anyway, I've actually decided to stop in terms of plastics, at least for now. I can't say never, because my GP and my plastic surgeon have both flagged the fact that my legs and my back, my bottom and my back, are probably going to cause issues as I get older because of the way that my skin is. It's as crepey back there as it was on my front. But I'm just not in a place emotionally or financially where I want to commit to that kind of surgery or the risks. So another thing that's always something to be mindful of, I guess, is I didn't realize just how, like you, Damo, I didn't really understand, I guess, just how big the surgery can be. Not to be fearful. I mean, these surgeons are well trained. They understand exactly what they're doing, but recovery can be unpredictable, and our bodies can do unpredictable things. And my body often does do strange and unpredictable things. So for me, I know that my bleeding risk is quite high. And do I want to put myself in that kind of risk? No, I don't. So I'm very happy to live with a little bit of saggy baggy for now. But I also completely respect that there are people that do not want to do that.
Yeah.
And they want to, get all of their skin sorted out. And so that's awesome. If that's the path that you want to go down, that is completely and 100% something that you should definitely pursue.
Yeah. And that's the thing, isn't it? It's such a personal
it really is.
choice. And I think it's wrong for people to put that sort of pressure on anyone that, oh, you shouldn't get it done, you should be happy how you are, or yes, you should get it done because, you look so much better. Well, it's none of your friggin' business how I look.
Yeah.
If I want to do something because, I need to for my health or for just for me, for my mental health, then we should be able to do that.
Yeah.
And I know, so Tash has talked about how at this point, no more plastics.
Look,
I'm still looking into it because I want to get my boobies done.
100%.
It's something that has always affected my mental health and emotionally, and for me,
we discussed it recently, didn't we?
Yeah.
I mean, I don't know how much you want to say here, talking to our wonderful Bari Chronicle audience, but
I'm good to talk about it because I think it's an issue that a lot of men go through.
Yeah.
That they don't get to talk about it.
I mean, man boobs are they are a thing. Like it is a thing, and it is definitely something that, from what I have seen and from the conversations that I've had, it is something that can be really, really traumatic for men to be dealing with post weight loss surgery.
Yeah. And
I mean, in general. But
see, I hoped that, and I was always told, if you lose weight, it'll all go away.
It'll all go, yeah.
Lost over 100 kilos, and all that happened was that I had an even nicer set of boobs.
So for you, it's gynecomastia as
well,
isn't it?
Yes, and it's been recommended that I have a full mastectomy, to deal with it, and it's a lot to sort of take in.
Yeah.
But at the same time, the thought of being able to buy clothes that are the right size, where I don't have to buy a bigger size to suit my chest, as opposed to my waist, because that was something that I never realized, and after I had the skin removal especially, was how much smaller my waist was going to be than my shoulders.
Yeah.
Because my waist had always been bigger.
Yeah.
And all of a sudden, I was in much smaller clothes, especially after the skin removal, because I wasn't trying to tuck skin into my pants.
Yeah, 100%.
And that was a daily occurrence, tucking skin in. I actually had a friend who he had weight loss surgery. I met him online. He had weight loss surgery a few weeks after me, and he went on to lose over 100 kilos. Amazing job. He wasn't in a position to get plastic surgery, but he wanted to do park runs and all that sort of stuff. He would actually wrap his loose skin in Glad wrap. That was the only thing that he could do to keep it from all moving about and pulling, and my heart used to break for him, because he was getting on with his life. He was out active, but he would spend an hour every day wrapping himself in Glad wrap. And
heartbreaking.
Just totally heartbreaking. Thankfully now we have a lot better compression wear, and
absolutely.
And that's another thing. If we are looking at plastics, these are the things that we have to keep in mind. We're going to have to wear compression garments.
Well, some
of us do, some of us don't.
Some surgeons recommend them, some surgeons don't recommend them. I definitely
I
lived in compression, and my surgeons actually requested a garment made for me to wear pre-operatively, because my organs were out of place. Because of the sheer size of the defect in my stomach wall, my organs were all moved and they weren't in the right spot, and my surgeons like to compress everything prior so that your lungs get used to not having quite as much room once everything's put back. So that was like a process for me as well prior to my first surgery. That was unexpected. Not all surgeons do that, but mine do and did, and that was that was a thing.
And then some they insist on seeing you multiple times afterwards, because they do wound treatment with
with lights and laser and all that sort of stuff. I did also have that as well. I had really brilliant aftercare. My scarring is minimal. I've been incredibly fortunate in that regard to have healed really well. But in saying that though, and I was thinking about this the other day, I actually kept my scars covered for 3 months. Like they were taped for 3 months.
Yeah, well, I had to have a dressing over mine for the same amount of time, and I developed an allergy to the dressing.
Yeah.
So then it was trying to find
something else,
allergy, low allergy ones, and there's so many options now, which is great, because if I go into hospital and they just stick a regular tape on me, then I get welts and rashes and so I think if I had have had a garment to wear though, it would have been a lot easier
for you.
So these are just things that we have to keep in mind, and they can be quite expensive too. And that's where the health funds as well, it can be good. Like private health doesn't cover heaps,
but it does cover
a bit. It does cover some stuff. Sorry
everyone. I mean, I definitely found the garments to be great. Like I hated it initially. I hated my garments. I hated them. But then as time went on, I really came to love wearing them, because it just gave me a feeling of security around, like the scarring and the wound and everything like that. I did go on also and have my arms done. So I've had my arms done and like down my sides to get rid of some of the side boob, but I still have a lot of skin. And I am strangely now okay with all of it, because I've just decided that I'm at peace with how I am. But like we've said, Damo's going on, he's going down that journey. So where are you at with that?
Well, I've sort of trying to decide when I'm going to have a bypass.
Yep. That makes sense.
I have decided that that's necessary for me because of reflux and type 2 diabetes rearing its ugly head. So I wouldn't be doing it if it wasn't for health reasons. I'm happy even the size that I am. So probably I'll do the bypass first before I look at having my chest done. I think probably a bit safer as well to be that, lose a little bit more weight.
Yeah, a little bit more weight.
And hopefully get the diabetes under control, because the type 2 diabetes can affect healing and more prone to infections. And I get infections anyway, so I don't really want to be doing something until I'm on top of the rest of the health issues.
Yeah, really sure about all of that, which is completely understandable.
Yeah, so probably another couple of years really before I get to.
Maybe not. Hopefully, it won't take that long.
Yeah. So, but I'm looking forward to it. I'm excited about the future now, because I'm feeling a lot better in myself.
Yeah.
And coming to the realization that it's okay to be happy in myself where I'm at. Tash and I have been involved in these massive discussions about obesity bias and the way we talk and the way our world is framed by words, by media, by school, by organisations that we've been involved in, and it frames our world outlook.
It does.
And getting in touch with the amazing surgeons and doctors and psychologists and dietitians that we've been in touch with over this last year, we've started changing the way we even speak about ourselves. And probably most of you will have noticed a bit of a change. We refer to living in a larger body, obesity, bias, and things like that, because it's not something that should define us as a person.
That's exactly right.
I shouldn't be defined by my size or my weight. It's no one's business. We actually interviewed a surgeon a couple of weeks ago who talked about the fact that she doesn't even ask her patients how much they weigh. And I was just like, that is amazing. Because she said it's none of her business. She doesn't need to know that. It would be different for an anaesthetist. He probably does need to know, if he's putting anaesthetic in, how much we weigh, so that he can get the right mix. But for her, and after surgery especially, they're on their journey. She doesn't need to know how much they weigh. And it really spoke to me that there are people now in the health profession, in that world, that it actually doesn't matter to them what size I am or what I look like.
Yeah.
They see my worth as a person.
I think, Damo, I think that really, when you've been a part of a weight loss surgery community like Bariatric Support Australia for as long as we have, you can, we're so passionate. We're so passionate about people's right to be able to transform their lives and live their lives on their own terms. And when you see the struggles, when you hear the struggles, when you read them on a daily basis, and you know that people are so much more, that there is so much worth and value in every single person, and you want everybody to see that and to know that, it can become incredibly heartbreaking and difficult when it doesn't feel like the narrative's changing. But we're seeing a change. We're seeing professionals in all spheres rising up, saying, no, it is not okay to be bigoted. It is not okay to have this bias. And just because I choose to be in this body does not diminish anybody else's right to be in their body and be whatever size they choose to be and have their particular health goals. And I think that that's just something that's done my heart so good, is understanding that there is a growing voice that believes that. And it's definitely done my heart good. I know it's done your heart good as well, Damo, because these are things that we've been talking about for so long, that we want to be part of a change. We want to be part of a change. We want people to understand that if you are in a bigger body, you have just as much worth, just as much right, just as much access. You should have just as much access to wonderful healthcare. You should be treated exactly the same as anybody else. And if you're not, what I would say to you is to find different professionals to have around you.
Yeah.
Because having the right people around you definitely is so empowering.
Yeah. Yeah, it's funny. I used to almost be, I was scared to go to a new GP because 100%. I thought my last one would get offended.
Yeah.
It's like going to a different hairdresser and then you go back to the original one and they go, oh, you've seen someone else. And they take it personally. But it's my hair.
That's right.
It's my health. Yeah. And if I'm not getting what I need, and, we've exhausted the, talking, the whatever we can to restore or keep a relationship, walk away.
One of the really interesting things when I sat down with my plastic surgeon, I said from the very beginning, when we were talking about breasts, that I did not want breast implants. I have nothing against people that want to have breast implants. That's awesome, fantastic. Just for me, for my health, my body does odd things. I didn't want to go down that path. And it was really not what was advised because just of my anatomy. And I really didn't have any sort of fat of any note to put anywhere. So they were going to be extraordinarily small and flat. I was thrilled. So excited. Hooray! They will be small. You mean they'll be small? Do you mean that when I run, they are not going to flap? Like, holy shit, that's amazing. My neck won't hurt. My back, do you mean that my back might actually not ache every day? Oh my God. Yes. Like, sign me up. Take them now. Be gone from me, excess skin. Like, that was my attitude. And the surgeon was, I think, quite surprised because I had already made that decision long ago that for me, I wanted to have small breasts. That was what I wanted. And I have maintained that 100% through the last 4 years.
And let's face it, most surgeons aren't used to hearing the word no from their patients.
Yeah. And I said no. And I have continued to say no. And it doesn't mean that I'm offended that he keeps saying, this would look great. I have no doubt it would look to someone else's aesthetics and to someone else's image and what they perceive would be great for me, but it's not for me.
Yep.
And it's okay that it's not for me. And it's a message that has just become so much a part now of who I am. It is okay to say no. It's okay to say, no, that's not for me. It's okay that I don't want that and that someone else does. And I would advocate so hard for someone else to have exactly what it is that they want. But it's okay for me to want what I want.
Yep.
And it's important to learn that we can say no. We can say no to surgeons. We can say no, about a particular something or whatever. That's okay.
Yeah. Yeah. It's like you and I. There's things that, like with our skin removal.
Yeah.
Tash has decided no more. I've decided I'm going to. It doesn't mean we're not friends.
Yeah, it doesn't mean we're not friends. It doesn't mean that I think that that's a terrible choice. It means that that's Damo's choice. And because I care for him, I support him in his choice. And I think that there's a really good lesson in that.
Yeah. Thank you so much for joining us this week. We hope you've gotten some great information out of it. And we just really want you all to stay safe and have a good week.